Hello, my name is Kaylee Rowe. I'm a third year family medicine resident from Lawton, Oklahoma at the Comanche County Memorial Hospital. I chose to do my quality improvement project over improving fluoride varnish applications in our LCHC family medicine residency clinic. Um, in rural Oklahoma, there's pretty limited access to healthcare in general, but even more so to dentistry and to take that further, pediatric dentistry. The wait time can be pretty extensive. There in Lawton, we have approximately two pediatric dentists, and then the surrounding areas, there's even fewer. So wait times to see a pediatric dentist can be up to 6 months, if not more, depending on what you're waiting on in your insurance. Um, this is important because dental cavities are one of the most prevalent childhood diseases in the US. There's been some longitudinal studies that have actually shown that childhood caries can lead to be an early indicator of poor overall general health in the pediatric patient population. An increased number of dental cavities experienced by age 5 has been associated with higher risk for metabolic abnormalities and a faster pace of aging by midlife. Currently, being family physicians, we like to follow our USPSTF guidelines. The recommendation is to apply the fluoride varnish to children from 6 months or whenever they get that first tooth eruption to 5 years. And then, usually by then, hopefully, they're established with the dentist. The ACA mandated in 2015 that all individuals in small group plans, including Medicaid, are to cover essential health benefits, which does include those pediatric dental services. So this is going to include the fluoride varnish, but that's not only for those patients when they go to see their dentist, that also counts when they come to see us in the clinic for their well child checks. And that's something that I don't think a lot of parents are aware of, and some practitioners aren't even aware of, that it can be covered up to 4 applications per year and can be provided by you, the primary care provider. So they can get 2 applications of fluoride, ideally 6 months apart, from you as the primary care physician. And then they can also still get 2 fluoride applications when they go see, when they are able to, their dentist for those regular visits as well. Prior to this project, our clinic hadn't really been providing any fluoride varnish treatments on a regular basis. There's been some residents who have done this or similar project in the past, but it had just kind of went by the wayside as far as people applying it and knowing about it and knowing how to bill it and knowing what needed to be in the notes for us to get reimbursed and the patient not to get a bill. Um, So my thought was by offering fluoride varnish treatments at regular office visits, such as well child checks, this could help expand access to fluoride treatments and thus decrease the amount of dental cavities in our rural pediatric population. So my aim would be design and implement a template for fluoride varnish applications for pediatric patients, because as I mentioned before, that's the big thing when you're trying to go through your clinic is being efficient. And then also to just aim to increase fluoride varnish treatments to eligible pediatric patient populations at our clinic at the Family First Residency by at least 25%. And I was going to do this from March of 2024 to March of 2025. So these are my results. Um, I didn't meet my 25% goal that I had stated. I got 11%. Looks like these are patients aged 6 months to 60 months who this code, which is the CPT code for fluoride varnish, was on their chart, as well as this ICD-10, which is the well child check visit code. And this is only for our Family First residency clinic. And this is just the same number, it's just in a different graph. If you like seeing stuff like this better than this total percentage. Uh, as you can see, the numbers didn't really get, let's see, we got 24% one time. Um, but otherwise, yeah, like I said, our total was 11%, but look at the consistency at least, starting from, March of 2024 all the way up until March of 2025. So from these results, you can see that using a template is going to increase the resident utilization of fluoride varnish applications. It's going to ensure that we have the correct CPT coding. And then I also made a template, so providing an appropriate template increased appropriate documentation and then increased consistency because it made it easier. So my methods were like I talked about using a template. Um, the template kind of went through asking some oral health screenings, helping to categorize each patient into low, moderate, or high risk for dental cavities based on specific questions on if, like we're brushing, if we have buildup, if parents have recent cavities, stuff like that. And then it automatically put in the procedure template, the code, the 99188, and then some brief preventative counseling. Um, I did give a presentation over this project to some residents, but it was last year, so I missed out on some of the first years who are coming in this year. Uh, so I tried to get the word out for them to use this as well, so it wasn't just me providing this fluoride varnish. I got these numbers by, like I said, tracking the CPT codes over that specific time frame from March 2024 to March 2025. And then data was analyzed by comparing total number of well-child visits, like I said above, um, to the number that got the fluoride varnish. And then this column here, I was first introduced to this topic when Denise came and spoke to our residency clinic about, applying fluoride varnish and especially to our Medicaid population who she deals with. And a lot of our patients, like most residency clinics, are Medicaid patients. And so they're more limited at the pediatric dentist they can see. So it's really important that we're kind of bridging that gap for these patients until they can be seen by a pediatric dentist. So making sure we're applying the fluoride varnish. For them, the percentages, they're about the same, like 11, 13, 17%. She did want me to note that most recent months numbers are subject to change as claims data is delayed 2 to 3 months. Um, so I don't have some of this other data. And this is specifically just for sooner care patients. So we still applied some. It just might not have been to sooner care patients here. And these are the same numbers. It was about 10% of our sooner care, which kind of equates to this number too. So, in conclusion, um, we weren't previously providing this at a regular basis, and now it looks like we are pretty consistently applying it. We do have poor access, like I talked about, to dentists, so it's important for us to bridge this gap for our patients. And then, as osteopathic physicians, we understand that the body's a unit. So, if one area has a dysfunction, such as cavities, poor dental health, early in life especially, it can lead to other issues down the road as far as the patient's health. Um, so my aim was to increase for eligible pediatric patient populations by 25% over 1 year, but as we talked about, I didn't make that goal. But I think just the consistency of offering it is a good start, and I hope that my future colleagues keep doing this, and I plan to do it myself in my next phase of attending hood. So basically what I got from this was utilization of templates is effective in helping with proper documentation, ease and compliance of proper coding. Um, it helps everyone just comply better with using them because everything's already there for them. Um, and like I said, I plan to implement the Floored Varnish applications in my future practice, and I hope that my co-residents will as well, and they'll continue to offer this for our patients in Lawton. Thank you.